anticoagulant foods or foods that prevent blood clots. There are certain food compounds which, like the aspirin, are antagonists to thromboxane. Latest studies suggest that diet can have enormous influence on blood clotting factors. Indeed, evidence suggests that the major influences of diet on heart disease have more to do with blood clotting factors than with blood cholesterol. The benefits of eating to modify blood clot factors are likely to work fairly quickly. A prominent French health official, Dr. Serge C. Renaud, says preventing blood clots can sharply cut your chances of heart attack within a year, whereas it usually takes longer to reduce heart attack risk by lowering cholesterol. However, many foods, such as onions and garlic, do both, and so they provide double benefits. The following foods are: chili peppers. Hot chili peppers are a powerful anticoagulant food. They are very effective in preventing blood clots. This evidence comes from Thailand, where people eat capsicum chili peppers as a seasoning and as an appetizer. This infuses their blood with chili pepper compounds several times a day. Research scientists believe that this may be primary reason why thromboembolisms, which is life-threatening blood clots, are rare among Thais. To prove the theory, hematologist Sukhan Vijayathan, M.D. and colleagues at the Siriraj Hospital in Bangkok conducted a test. They fortified homemade rice noodles with hot pepper using 2 teaspoons of fresh ground capsicum pepper in every 200 grams of noodles. Then they fed the peppery noodles to 16 healthy medical students. 4 others ate plain noodles. Almost immediately, the clot-dissolving activity of the blood of the eaters of pepper-laced noodles rose but returned to normal in about 30 minutes. Nothing happened to the blood of the plain noodle eaters. The effect of chili pepper was thus short-lived. However, Dr. Vijayathan believes that frequent stimulation through hot chilies continually clears the blood of clots. This makes Thai people generally less vulnerable to blockage of arteries. Clove. This popular spice is a powerful anticoagulant food. It helps keep the blood free of dangerous clots. According to Dr. Krishna Srivastava of Odense University in Denmark, cloves are stronger than aspirin in this respect. The primary active agent in this spice is eugenol, which also helps protect the structure of platelets even after they have been aggregated. Dr. Srivastava says that the clove works through the prostaglandin system more or less in the same way as do aspirin, garlic and onion. Cloves help reduce the production of thromboxane, which is a powerful promoter of platelet clumping. Fruits and vegetables. Fruits and vegetables high in vitamin C and fiber help prevent blood clots. Those who eat fruits and vegetables in liberal quantities have the most effective clot-dissolving systems, according to a recent Swedish study of 260 middle-aged adults. Those who ate the least fruits and vegetables had the most sluggish clot-dissolving activity. Other research studies indicate that vitamin C and fiber concentrated in fruits and vegetables also improve substantially clot-dissolving mechanisms and help prevent platelet clumping that leads to clots. Further, the lowest levels of clot-promoting fibrinogen are found in vegetarians. This is especially true in case of vegans who eat no animal products at all, not even eggs and milk. This is presumably due to the fact that compounds in fruits and vegetables lower fibrinogen, while animal fat and cholesterol increase it. Garlic. Garlic is a powerful anticoagulant food. It effectively prevents dangerous blood clotting. Even in moderate dietary amounts, it will help thin the blood, thereby reducing its tendency to form blood clots within the arteries. This was discovered by research scientists in the mid-1970s. Studies were conducted in India on Jain religious sect. While some Jains abstain completely from onions and garlic, on religious grounds, others eat them in large amounts. A third group eats a moderate amount. The 3 population groups are very similar in most other respect, making it easier for a controlled study of garlic and onion. Those Jains who eat garlic and onions liberally, consumed nearly 500 grams of onions and at least 17 garlic cloves in a week. It was found that the blood of these people had less tendency to clot than the blood of the other groups, and the group that did not eat garlic and onion at all had the highest tendency to clot. Drugs that thin blood are often prescribed after strokes, heart attacks, or blood clots in the legs or lungs. The use of garlic can interfere and render this drug more potent and as well reduce the side effects from improper doses. Garlic does not appear to make much difference when garlicked in cooked form for its blood-thinning effects. Group of researchers studied 20 patients who already eat. The patients took garlic in either raw or furry form for 4 weeks. Researchers measured their fibrinolytic activity, which is a measure of the tendency blood to form clots. Within 6 hours after administration, fibrinolytic activity increased by 72% with raw garlic and by 63% with cooked. These levels remained constant up to 12 hours after administration of a single dose of garlic. The levels rose steadily throughout the next 4 weeks of trial, until after 28 days the activity with raw garlic was 85% above normal and 72% above normal with cooked garlic. Ginger. Ginger possesses a strong anticoagulant property. Blood can be kept free of dangerous clots by eating quantities of this spicy food. It reduces the production thromboxane. According to Dr. Krishna C. Srivastava, ginger compounds are strong inhibitors of prostaglandin synthesis, the drug indomethacin, known for its potency. Ginger proven anticoagulant in humans. This was discovered Charles R. Dorso, MD of the Cornell University Medical College. He ate large quantity of Crabtree and Evelyn ginger with grapefruit marmalade, which was 15% ginger. When his blood did not coagulate as usual, he did a test by mixing some ground ginger with his own blood platelets, and found them less sticky. According to Dr. Dorso, the active agent in ginger is gingerol, which chemically resembles aspirin. Grapes. The grape, known as the queen of fruits, is one of the most valuable gifts of nature. Traka, the great physician of ancient India, called it the noblest of all fruits. It has immense therapeutic value, whether eaten as a whole, with skin, pulp and seeds, or used in the form of juice extracted from grapes. This fruit possesses anticoagulant property and it helps prevent the formation of blood clots. Its skin in particular contains resveratrol, which has been shown to inhibit blood platelet clumping and consequent blood clot formation. Black mushrooms. The Asian black fungus mushrooms are a valuable food that wards off clots. It is considered a formidable food in Chinese traditional medicine for its beneficial effects on blood. Dr. Dale Hammerschmidt, MD, a hematologist at the University of Minnesota Medical School, once ate a large quantity of mapo tofu, a spicy Asian bean curd dish, containing the mushrooms. After eating, he noticed dramatic changes in the behavior of his blood platelets. They had much less tendency to clump. He attributed this to anticoagulant effect of the black mushrooms. The black mushrooms are said to contain several blood-thinning compounds, including adenosine, also present in garlic and onions. However, button mushrooms do not contain these compounds. Dr. Hammerschmidt concluded that the combination of so many anti-clotting foods in the Chinese diet, such as garlic, onions, black mushrooms and ginger, may help account for their low rates of coronary artery disease. Olive oil. This oil is a potent anticoagulant food. It retards the stickiness of blood platelets, which may account for its artery-protecting powers. This is evident from a research study conducted by British scientists at the Royal Free Hospital and School of Medicine in London. These researchers made volunteers take 3/4 of a tablespoon of olive oil twice a day for 8 weeks in addition to their regular diet. Their platelet clumping was considerably reduced. The scientists found that platelet membranes contained more oleic acid, the dominant fatty acid in olive oil, and less arachidonic fatty acid. That encourages stickiness. The olive oil-fed blood platelets also released less thromboxane A2, a substance that commands platelets to cling together. Researchers concluded that olive oil benefits platelet function. They believed that this is one more explanation as to the people that depend heavily on olive oil, as in the Mediterranean area, have less heart disease. Onion. Onions are an anticoagulant food. Eating them in raw or cooked form helps keep blood free of clots. Harvard's Dr. Victor Gurwick advised all his patients coronary heart disease to eat onions daily. partly because their compounds hinder platelet clumping and increase clot-dissolving activity. In fact, onions have a truly wonderful ability to counteract the detrimental clot-promoting effects of eating fatty foods. This was shown by Dr. N. Gupta, professor of medicine at K.G. Medical College in Lucknow. He first fed men a very high-fat meal, with butter and cream, and discovered that their clot-dissolving activity greatly decreased. Then he gave them the same fatty meal, this time adding 55 grams of onions, raw boiled or fried. Blood drawn 2 and 4 hours after the fatty meal showed that the onions had totally blocked the fat's detrimental blood clotting proclivities. In fact, 100 grams of onions completely reversed the fat's damaging effects on clot-dissolving activity. There you have it, 9 classes of foods that prevents blood clots. Please share this video to your loved one. Here in My Health Corner, we believe proper nutrition in your body with healthy food and positive mind will heal you. Thank you for watching. Please like and subscribe to this channel and God bless everyone.